Hair restoration surgery is fairly diverse as far as there's non-surgical treatments like medications, PRP injections, and then surgical treatments. The more old school treatments were back in the day cutting out areas of the bald scalp and then sewing that together and hoping that you're bringing hair-bearing areas together. And that worked to some degree. And then that was kind of replaced by punch grafts, which is also a super old technique that I never learned that. But you had like a doll's hair appearance, which was very obvious. And then that got replaced with, strip excisions, where you would cut out a strip of hair in the back of the scalp and then cut those into 2-3 hair units, which was nice. Like that worked. You could get a very natural hairline. All that was good. However, you didn't really know how much hair a person would lose. So if you were to do those techniques on younger patients, which I saw some patients in different cities that I've traveled to, where they have like a good growth of hair in their forehead that was transplanted, but all the hair around that now fell out and it just looks like a mess, or how could this happen? It's very unnatural. So when the NeoGraft technique came out, this was, I don't really want to say a non-surgical, but a minimally invasive way of removing single hair follicles from the back of the scalp and replacing those in the front of the scalp. So it mimics exactly how our hair grows. So that technique I find is fairly powerful because it is essentially scarless, where there's no linear scar. And in my practice, I can treat younger patients because, my younger patients will come in at 25 or 30 years of age and say, I want to get my hair done. I tell them, well, you're only 25 or 30. How much hair are you going to lose? We don't know what you're going to look like at 50. And they tell me, I don't care what I look like at 50. I want to look good now. I want to get married, find someone, do all those things. And they really want you to do something with their hair surgically. So this is where I find the NeoGraft has helped out, because now I can tell them, we don't know what your scalp's going to look like in, 20, 30 years, but we can basically remove hair from the back of your scalp, replace it where you want it. And if you lose everything else around it, and we don't have anything better that science can offer in 20 years, you would be willing to shave your head and you're okay with that, then I think they're a good candidate even at 25, because they getting the hair they want now, and there really isn't any downside to it. Even if nothing better comes along and they shaved their heads, there wouldn't be all these telltale scars in the back of their scalp, which I think is a little bit of a tragedy.